Warning tonight from local healthcare workers about a severe flu season. It is happening all while COVID cases are also still increasing right here in the Quad Cities. This dual outbreak could lead to a twindemic unfolding in the winter months. A twindemic could place increased pressure on hospitals. Local 4's Sarah Krug joining us live in our newsroom with more on how health professionals plan to handle this issue. Sarah.
And the chief medical officer for the University of Iowa healthcare system confirms one of the greatest concerns about the uptick in flu cases is the toll it could take on healthcare resources. This includes not just exhausted doctors and nurses, but already limited hospital beds and medical tools.
Flu is here
and spreading rapidly.
2 weeks ago, we had one case. Last week, between Tuesday and Saturday, we diagnosed through our clinics in our lab over 150 cases of influenza,
sparking concern of a twindemic in the works.
Our healthcare system is already strained. Our workers have been doing this for almost 2 years now. We're anxiously watching this because we feel like we're going to have another spike.
A notable change from last year's record low flu cases.
People are not masking like they were last year when you go out to the grocery store or to a shopping center. Because the flu season was so mild last year that people may not be getting vaccinated like they have in previous years.
Exhausting already limited resources.
There's also a shortage in workers. Now people are retiring earlier, people are changing jobs, people are leaving.
Vulnerability crossing age groups.
We really worry about the very young and the very old. When someone has influenza, they generally know it. They feel bad, they have high fevers, they really feel terrible.
Two concurrent viruses, making detection more difficult and COVID-19 harder to trace.
They might have symptoms as mild as, sniffles and sneezing and things that feel like allergies, but they still have it and still can transmit it. It will continue to infect people unless we take appropriate precautions.
Professionals say it's not too late to try to protect yourself. They say vaccination is the best way to minimize spread for both viruses, but masking up and continuing to socially distance would help too. In the newsroom, Sarah Krug, Local 4 News.
Sarah, thank you.